Los Angeles. I'm here to terminate unwanted skin bumps.
The theme of our talk today is the career dilemma of Acne Keloidalis Nuchae. Now you see, Acne Keloidalis Nuchae is a condition of bumps at the back of your head that you develop. They're like razor bumps. You get them when you shave your head and you are genetically predisposed to developing them. You didn't bring it upon yourself. You're born that way. You just happen to find out when you shave your head too low and you develop these bumps. It's nothing to do with dirty clippers or anything like that most people think. It's just a genetic thing, and it afflicts men of color, especially people of African descent or Hispanic descent. That's the story of this patient, as is the story of many a man of color that is in the armed forces or any job that requires sporting a clean-shaved look. Many of these patients have been told that there's no treatment. As in the case of this patient, he's tried Accutane, which is the very toxic acne medication that a lot of doctors will try to use for this condition, to no avail. He's tried all sorts of topicals, injectables, to no avail. He presented. We did excision using techniques that we developed at this clinic at Bombinator, and using tools that we developed and invented for the purpose of this procedure. I invite you to watch the before and after and let me know if we succeeded.
After I actually came back from the military, I had my head shaved for the first time and then started noticing hair bumps. And it wasn't until like a few years later where the hair bumps got big enough where they started to feel uncomfortable. A military doctor actually told me that I had Acne Keloidalis Nuchae. And they did tell me that the only thing they could do for it was injections or maybe some topical creams. It was kind of frustrating because, you know, in the military, you do have to have your hair cut short all the time. And unfortunately, that did leave the back of my scalp exposed with this condition, which at that point was very unsightly. You do get people that actually comment on it. So, you know, being in the chow hall, for example, in the line, you'll get people that you don't know looking at the back of your head, and sometimes they do make comments. So that was very uncomfortable. And then, of course, along comes the actual other symptoms, which sometimes it bleeds. Sometimes you'll get pus that comes out of it. Not the best thing to have in the military when you need to have a short haircut. So I found Dr. Umar on Google, and then I did see a few of his videos. And the reason why I actually chose Dr. Umar to actually do the surgery is because of the fact that he actually advertised that he actually helps treat that condition. So on his website, he does have an entire section where he talks about AKN. There aren't a lot of dermatologists out there that are willing to do any type of surgery on AKN, and a big part of that is because we are prone to forming keloids. Sometimes you do get a reoccurrence of it, and so I figured, you know, if Dr. Umar has an entire profile set up on his website where he talks about his past successes, I figured he's probably the best dermatologist out there to perform the same surgery on the back of my scalp as well. I was definitely very happy that there was a dermatologist out there that was willing to do the surgery. There's a bunch of symptoms that come along with having AKN, and so not having to deal with that anymore, and specifically not having to go to a dermatologist once a month where they would do injections into my scalp to kind of minimize the symptoms. That was very nice. How long, this whole thing would take to heal? He did say that, it could take up to 6 to 8 weeks for everything to kind of heal. I was fine with that. I've been dealing with the AKN for over 17 years. So if 6 weeks is all it would take for this entire thing to go away, it was well worth it. I feel great. One really nice thing is not having to feel that slight achy pain that you get from AKN once it starts to flare up or it starts to get tender. So that's great. It's really nice not having to worry about getting blood sometimes on your pillow, especially once it does flare out. It does have a tendency to bleed, so that's really great. Now that my hair has grown out a little bit, I don't actually worry about people seeing a giant bald spot in the back of my head, even though technically I do have a scar back there. I don't think about having AKN anymore, which is really nice. I feel fantastic. I really appreciate Dr. Umar doing the surgery on me. I feel is really great. I don't have to worry about those achy pains anymore, and I feel great that I don't have to, spend a bunch of time in the morning trying to blend my hair in with the giant wound that I had in the back of my head. I would like to thank Dr. Umar as well as his staff for treating me so well when I was out there, and of course being very patient with me while we went through the surgery, and very much appreciate that. Thank you.
So I hope you enjoyed the video. If you do, don't forget to follow us on Instagram or leave a comment. We'd like to engage you, and we'll appreciate that. Thank you.